Hello, I'm Maria Williams with the Collaborative on Health and the Environment. CHE enjoys bringing you the latest environmental health science through our partnership calls and webinars, science serves, publications, and social media. I would like to welcome everyone to today's CHE partnership webinar, which is titled The Future of Environmental Health, Engage Communities and Strengthen Partnerships. Our moderator today is Cheryl Patton, Director of Commonweal's Biomonitoring Resource Center. We will leave time following the presentations for a brief Q&A session. You may type in questions through the Q&A feature available on the menu bar at the top of your window at any point during the presentations. After the presentations, our moderator will read out questions for our panelists to respond to. We will get to as many comments and questions as we can during the Q&A period. For those of you who called in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on the webinar right now is muted with the exception of our moderator and our speakers. This webinar is scheduled to last for 45 minutes and is being recorded for our call and webinar archive. With that, I'll turn things over to you, Cheryl.
Oh, thank you very much, Maria, and thanks everyone for joining this call. I'm really excited about it. As Maria said, the title of this webinar is Future of Environmental Health, Engage Communities and Strengthen Partnerships. And this webinar is part of a series of 10 webinars featuring members of the next generation of environmental scientists doing cutting-edge work that will drive both environmental health science and advocacy in new directions. And we selected these scientists, these young pioneers, in collaboration with their peers and their mentors who recognize them as doing really important work. And so we're very pleased that you all have joined to listen to their presentations today. We're going to start with Megan Latshaw from the Environmental Health and Engineering Department, Johns Hopkins Bloomberg School of Public Health. She's going to describe the course of her career, bringing together state health organizations with the communities they serve to increase community well-being, ending with a really interesting description of the Bloomberg Public Health Initiative. And then we'll move to Sara Wylie's presentation. Sara is Assistant Professor of Sociology, Anthropology, and Science at Northeastern University, and she's going to be talking about exposures from natural gas production and how communities members have come together to measure those exposures in very exciting and solidly scientific ways that's going to influence policy. Now, you can learn more about both of these young scientists on the CHE website, and you can also find linkages to their own websites to give you just a little bit more information about them. So I encourage you to do that. So we're going to start with Megan, who will talk about 15 minutes, and then we'll go right to Sara with her presentation, and then we will open up to questions and answers. So Megan, do you want to go ahead and begin?
Great, thank you so much, Cheryl. So I'm going to talk about the year 2009, which was a really big year for me. In February, I gave birth to my first and only child. Here I'm showing the pre-birth picture for everyone's sake. I was a little bit more relaxed and well rested at that point. But then in October, after giving birth in February, I went to the National Environmental Public Health Conference, and it was my first time traveling since giving birth. And I'm not sure if it was the fact that I had to leave this cutie behind when I went on the trip, or maybe it was leftover hormonal imbalances, but during a session on the National Conversation on Public Health and Chemical Exposures, I saw a mom, and she was standing in the back of the room, and I thought, well, that's interesting. Usually you don't see people bringing their children to sessions at scientific conferences. And I kept staring at her, thinking about my own baby that I had left at home and looking at how cute her baby was and wondering what she was doing here. And when the woman stood up to talk, I sat up because I was intrigued to hear what she had to say. And she told a story. She said that she lived in a state near the border with another state. And in her state, it was legal to burn pesticides. But in the neighboring state, it was illegal. And every night, there would be trucks that would drive across the state line into her neighborhood. And every morning, they were basically taking the pesticides to be burned. And every morning, they would wake up and there would be ash all over everything in her neighborhood. Cars, the lawns, anything that was outside would be covered in ash. And so when this woman got pregnant, that's when she really started to worry about it. I guess, you know, it's one thing worrying about your own health, but worrying about the health of your children. And so one day she didn't know what to do or who to ask. And one day she stopped a police officer who was driving around the neighborhood in his patrol car. And she said, who do I ask to find out what this ash is? And he told her, well, I don't really know, but why don't you try the Department of Natural Resources? And so she called to them. And they said, yeah, that's not really our purview. We think you should call the Department of Environmental Protection. And so she called the DEP, and the DEP pretty much said the same thing and told her to call the Department of Health. And the Department of Health told her to call EPA, the national headquarters, and EPA told her to call ATSDR. And so this meeting was being convened by ATSDR. So when she went to look up their information, she decided that she was just going to drive to the meeting. Because she couldn't seem to find answers anywhere. And so she drove across 5 states with some other people from her community to try to figure out who could answer her very legitimate environmental health question. So why am I telling you this story? Partly because this is the first time that I realized that as a field, environmental health was not doing the best that we could. In fact, I think it's pretty clear that we were failing this woman and her community. And unfortunately, many others like them. In fact, we've also failed Sydney Johnson. This is Sydney's mother holding a picture of Sydney. Sydney died at age 22 from asthma, just before she was due to graduate from college. We've also failed Nikki Hitchcock's daughter. This little girl was diagnosed with lead poisoning, and the mom did everything she could. She removed all the paint, made sure that there was nothing in her soil. And it wasn't until they installed a tap water filtering system that her daughter's lead levels went back to normal. And we're also failing this young man, Luke. Luke's mother has a Facebook page. It's called Saving Luke. And she talks about going to her child's bedside in the middle of the night so many times to prick fingers, to give shots, and to make him eat, all while he sleeps. And I know that the reason that we fail is often beyond our control. My husband is a stockbroker, and he likes to say, Megan, he gets really irritated, what's the answer to 99 out of 100 questions? And then I get irritated because I don't like the answer to his question. And according to him, the answer is money. But I'm going to argue through the rest of this that I think we use this as an excuse in our field, myself included. There have been so many times when I had ideas for what we could do better or what needed to be done to improve environmental health. And I went around and told other people, this is what we should do. This is what somebody needs to fund. But it was every single time that I decided to take the leap and just do it myself that it seemed to somehow work out. And so that's going to be my challenge to you today. So back in 2004, I had just started my dream job at the Association of State and Territorial Health Officials, or ASTO for short. For those of you who don't really know governmental public health, every state department has a health department. Every state has a health department. And the state health officials are typically appointed by the governor, and they don't always serve a very long time because when governors change, state health officials tend to also change. It was hard to get the state health officials interested in environmental health. They really were just always responding to whatever the latest issue was. And back in 2004, it was pandemic flu, and they still had 9/11 fresh on their minds. But anyway, in fact, one of the things that ASTO was doing when I was there at this time was they had formed the State Preparedness Directors Group. And this was a group of career civil servants. So people who had been working in the health department for a long time, who knew what was needed on a day-to-day basis, and who knew the challenges of the health department and of the health in their state. And I decided that's what we needed for environmental health, because it was so hard to get the state health officials interested in it. I knew that every state health department had one person, or at least one person, who worked on environmental health issues. And so I said, well, we need a group for them. And it seemed to make a lot of sense to me, but sometimes that's not always the case with others. I talked with ASTO staff, with the state health officials themselves, with my CDC project officer, anybody who would listen to my idea. Staff was worried that the group might ultimately break away from ASTO and then end up competing with us for funding. The CDC project officer said, well, we don't have any funding to make this happen. And there was nobody out there who seemed to think this was as good idea as I did, except there was one person, Lisa Conti from Florida. She was sort of the state environmental health director in Florida. And she also seemed to happen upon this idea at the same time that I did. And finally, after a year of talking about it, I decided just to do it. Just do it. I thought, all right, there's no money, but we can make it happen, right? I was so nervous. After all, who was I to go ahead and do something like this? I never thought we'd make it work without funding, but we did. And now, more than 10 years and a couple of hurdles later, this group is still going strong. In fact, I saw the environmental health director, ASTO's environmental health director last week, and he said that this group is doing very well. And it's one of the best parts of his job is getting to work with them. So similarly, when I worked at the Association of Public Health Laboratories, or APHL for short, and one of the best places I've ever worked, I kept telling people we needed to expand biomonitoring in order to answer questions at the state and local level. So right now, CDC has a very strong biomonitoring program, and we have the National Exposure Report, but if you're a community with a question, you can't use CDC's data or National Exposure Report to answer your question. And so I told CDC, I told EPA, I told conferences full of scientists, I told groups of practitioners that we needed to do this, but nobody was doing it. And so once again, I realized I needed to stop whining about it and just do it myself. Again, we had no funding. And again, I was nervous because this was bigger than me. We needed to get on board not just public health laboratories, but we needed to get epidemiologists and toxicologists and state health officials and CDC and EPA and NIH. And so what we did is we got them all around a table and we said, okay, this is our idea. We want to build a network, a national biomonitoring network. What do you guys think? And they all enthusiastically supported the idea, which made me even more nervous because then that was one hurdle that was out of my way and I had no more excuses. But in 2016, APHL did launch the National Biomonitoring Network. It's still very young and still has a long way to go and still doesn't have any funding necessarily set aside for it, but it exists and that's a big step forward. So I'm really excited about that now. But why am I telling you these stories? It's because I wanted to show that I've used lack of funding as an excuse. But based on these experiences, we need to stop doing that. Besides funding, I think that the second biggest excuse that we use is time. It's another resource that a lot of us don't have much of. But I argue that if you're committed to something and you see value in something, you make it a priority and you find the time. And that brings me back to the title of my talk, EH 2.0 or Environmental Health 2.0. And it brings me back to these people. We need to figure out how to improve our environmental health system so we no longer fail people like this and communities who have legitimate environmental health questions. So how the heck are we going to reinvent the environmental health system, right? Again, this is way bigger than me, and I really wish I had the answers, but I don't. I'm tempted to start by looking at the system the way that it works now. But I found that sometimes the best thinking comes when you just start from scratch and envision how the system should work as opposed to how it does work now, asking what what are our goals and how can we get there? My inclination is to let the public tell us what they want from us and how they want it. I think we need to put the public back in public health. The problem is they don't even know that our field exists, let alone half of the programs that we implement on their behalf. Yet, when people are interviewed, they resoundingly support programs for clean air, for safe food, for clean water. Going back to the woman with the baby at the meeting in Atlanta, I really wanted to be able to help her. But again, I thought, well, what can I do? I'm just a director at the Association of Public Health Laboratories. It wasn't until a year later when I set aside some time to take a step back and to think big about a different problem. It was the fact that I felt like our environmental health laboratories were being underutilized. So I was taking a step back, I was thinking about how our environmental health laboratories were underutilized, and all of a sudden I remembered this woman, and I thought, we could have used these laboratories and all the capabilities that we've built up, especially since 9/11, to answer her questions. We could have tested the ash to see what was in it. We could have taken a blood sample or a urine sample and told her if she was being exposed to something above levels that were considered background levels. And so out of that was born a project called Meeting Community Health Needs. And the goal of this was to answer communities' environmental health questions through laboratory testing. And when I first came up with this idea, guess what everybody said? There's no funding for it. But at this point, I kind of felt like, yeah, so what? We're going to do it anyway. The other concern was from the laboratories, they were worried that people were going to start to show up with mayonnaise jars full of urine and leave them on their doorstep. And they were worried that they were going to be inundated with so many requests from communities that they weren't going to be able to meet all of the needs. But I challenged them and said, well, first of all, I think we should, at the very least, find out what their needs are. We do work in public health. If we don't even know what the public is worried about, that is a problem. And we should make ourselves vulnerable, not only to having to say no sometimes because maybe we don't have the right method, but also being vulnerable to maybe saying yes and helping them out, to building bridges with the communities, the ones that we're supposedly serving. So I'm going to speed up. I think I'm going to need to finish this up quickly. I'm really excited that part of my work is with the Bloomberg American Health Initiative at Hopkins. And this was a part of a $300 million gift from Michael Bloomberg, who said, could you guys figure out how to make Americans healthier? And I get to co-lead the environmental challenges work group of this initiative. And we hope to try to figure out what is wrong with the environmental health system the way it is today, and how can we at Hopkins help to fix that, whether it's through education or partnerships or research. I also am really, as part of my work with the American Public Health Association, the environment section, I recently pledged to work with the current chair to have communities bring their issues to the section and then set up work groups to work directly with those communities to help them navigate the environmental health system, or to help them figure out what data needs to be collected, or who to talk to about their issues. Again, I'm really scared because will it work? How can we make it work? Are we setting up unreasonable expectations for these communities? All of this is still to be determined, but I'm really hopeful for the future. I'm hopeful because I get to teach some wonderful young minds, and I know that these students are engaged, they're eager, they're passionate, they're excellent systems thinkers. They always impress me every single day. And these are our graduate students, but I also teach some high school students in Baltimore City. And so I'm really excited that they're starting to learn public health and environmental health at younger and younger ages. And this is from my daughter's second grade class last year. They talked about public health in their class. So I'm hopeful. I think that I think we need to reinvent our system. I don't think we should be using lack of resources as an excuse. We need to put the public back in environmental public health and better connect with communities, whether it's through citizen scientists, community-driven programs. And we need to make sure that environmental health professionals are accessible and accountable. And each of us can make a difference. Don't think, well, what am I going to do? Like, I'm just this lowly person on the totem pole. There is something you can do. And if you're brave and you're willing to fail, you're not afraid of failure, then I think we should all go out there and try to do our very best. So I wish this was more about what we've done, but instead it's more of a call to action. If you want to join me in these efforts, feel free to reach out. I'd love to hear from you. Thank you.
Well, I'm very happy to be here, and I think my talk really supports a lot of what Megan's bringing to the table, which is really how can we rethink the process of environmental research and advocacy, and really through my research think about how we connect advocacy and research on two issues that are generally thought of as being separate. And so I've made a little do-it-yourself representation of this problem with climate change on the one hand, which is often managed as a separable issue from endocrine disruption research and toxics. And I study the boom in unconventional energy. And what I'm really interested in is how, when you begin to take apart unconventional energy, which was sold as this bridge fuel to a low carbon, greener economy, what we actually get is a Mobius strip, wherein unconventional energy is leading to more methane production, a huge boom in oil production, and actually increasing climate change. And then on the other side of this, unconventional energy is also demands a lot of endocrine disruptors. About 200 different chemicals are used in the process of hydraulic fracking and unconventional energy extraction, about 47% of which are estimated to be endocrine disruptors. The natural gas that's being produced is leading to a huge boom in ethylene production, which is a major feedstock for petrochemicals. So unconventional energy is actually creating this Mobius strip between the oil, gas, and petrochemical industries, and bringing together climate change and endocrine disruption. And so my question, what I'm going to dig into in this talk, is how can we as academics really begin to grapple with this Mobius strip, and what new opportunities does it present for both research and advocacy to think across these two issues? So let me just jump to my slides. Brilliant. So unconventional energy, as it's forming this Mobius strip, is also twisting the lives of everyday people out of their own control. The lives of people like Laura Amos, whose water well exploded in 2001, coincident with a fracking operation. And she became an activist around oil and gas at that point, but really faced a very hard time getting any answers about what was contaminating her water and what its consequences could be. 3 years down the line, she developed a rare form of adrenal tumor. And as she started really becoming an advocate around oil and gas, she came across a document that was written by Theo Colborn, a woman who many of you may be familiar with, who shared that one chemical used in fracking, 2-butoxyethanol, potentially causes adrenal tumors, though there are no human toxicological studies on 2BE exposure. And so Laura, despite having this contamination event, despite having developed an adrenal tumor, and despite being able to eventually prove through a lengthy and costly legal discovery process that 2BE had been used in fracking that could have contaminated her water, she eventually had to sign a non-disclosure agreement in order to get money to be able to leave her contaminated property. And it's cases like Laura's that really emphasize how challenging it is to study the Mobius strip of these two industries, because cases like Laura's don't get aggregated into toxicological studies, because as landowners confront these terrifying changes in their day-to-day life and their own health, they encounter scientific barriers and regulatory barriers that place upon them the burden to prove harm, and end up leading them to engage in things like non-disclosure agreements that make it even harder to prove the link between chemical contamination and human health harm. And those regulatory barriers that have made it hard to connect Laura Amos spouse's illness with chemical contamination have been very productive in further producing this Mobius strip. So 70% of the cost of ethylene production is actually from natural gas, which is used as both an energy source and a raw material for the cracking of ethylene. And so there's been a huge reinvestment in ethylene cracking by petrochemical majors since the unconventional energy boom. And so, for instance, Dow invested $6 billion in petrochemical production facilities in the US, which is the first time in 20 years that they've reinvested in cracking in the US. Shell is in the process of building a multi-billion-dollar ethane cracking and polyethylene production facility in Pennsylvania. So coincident with the fracking boom, there is also a big boom in ethylene production. And ethylene is the feedstock for a vast panoply of synthetic chemicals, and 2BE, 2-butoxyethanol, is one of those myriad of chemicals. And then when we look at who is actually producing ethylene, we begin to see again these oil majors. So ExxonMobil, Royal Dutch Shell, Total, and Chevron are all major ethylene producers who are reinvesting in the production of petrochemicals within the US at the same time as they're benefiting from both the natural gas and the oil shale boom. So as hydraulic fracking was sold as the bridge to a green, low carbon economy, none of the studies really investigated that hydraulic fracking is equally useful for extracting unconventional oil as it is for extracting unconventional gas. And so you can see here from the Energy Information Administration, there's been two parallel booms, both in shale gas production and in shale and tight oil production. And under the Obama administration, we saw an 88% growth in shale oil production within the United States, which is the largest in any administration's history. And along with that growth in both oil and natural gas production is a recommitment of financial investment in the future of fossil fuels. So in the past 3 years, the world's largest investment banks have collectively invested $306 billion in extreme oil. Just the DAPL pipeline alone cost $3.78 billion, $2.5 billion of which was financed from 17 different banks. So with these kinds of massive financial investments, we're wedding our futures collectively to profitable fossil fuels. So how do we bring that together at a moment when the evidence of climate change is becoming undeniable and it's becoming a lived experience around the globe? And how do we as academics really begin to account for these industries that are as wealthy and as long-lived as nations? And so I'm just going to swing through a few examples of my work that I hope illustrate some ideas for really how to begin taking apart and better accounting for this Mobius strip that really combine advocacy and research efforts on climate change and endocrine disruption by, as Megan suggested, really developing for grassroots community-based research, where we put frontline communities in the lead in terms of setting the research agenda, in terms of actually gathering data and studying their conditions and sharing that information through digital networks that are designed to network grassroots communities as well as nonprofits and academics to study these problems collectively through building open source public data infrastructures and open source research tools, really working towards theorizing and defending the public right to research and the rights of all of us as researched publics. So the first example of that in my work is a project that I did at MIT with the Extract group, where we developed a tool for community monitoring of the oil and gas industry called WellWatch. This was built on a MediaWiki framework where people could share their stories of what it was like to live around oil and gas. And this system was really designed to capture stories like those of Laura Amos before they are removed from the public record, and really begin to build networks that would support somebody like Laura in finding other people who are dealing perhaps with exactly the same company, but in two different states. So through WellWatch, people shared their experiences, doctors shared notes on the experiences of families that they were working with, and communities shared images of their experiences. So beyond just recording, as in anthropology and sociology we do, people's lived experiences, how do we amplify the ability of people to study their own environments? Following working on WellWatch, I was part of co-founding an organization called publiclab.org that develops low-cost tools for community-based environmental monitoring. Our first tool was a way of making satellite-like maps with helium balloons with digital cameras attached to them, and we organized people along the Gulf Coast during the 2010 Gulf oil spill to go out and take images of that spill as it unfolded. So a public lab is basically an open and public forum for research and development. You can find out how to build public lab tools on our website. You can see all the different people who've contributed to developing that over time. And you can see a map of research projects around the globe where people have used this tool to study pressing problems near to them. So there's a whole plethora of public lab tools that have been developed now, such as how to do spectral imaging with your camera, or turn your phone into a spectrometer, or a project that I'm working very hard on, how to map a neurotoxic gas, hydrogen sulfide, associated with oil and gas production using photographic paper. And there seemed to be a lot of traction toward the end of the Obama administration on this idea of really producing citizen science throughout the structure of the EPA. This is a report about a vision of citizen science at the EPA that would really engage citizen science in all aspects of the EPA's work and integrate citizen science data into EPA work actively. And of course, that all changed with the election of Donald Trump. And so that led me to collaborate in a networked and data-driven response to the dismantling of federal protections for environmental health called EDGI, the Environmental Data and Governance Initiative. And EDGI is a network of academics and nonprofits that first started by archiving sensitive environmental data. And we organized 30 public data rescue events across the country where the general public came out and just helped to archive data around climate change, data about EPA Superfund sites, and making sure that there are publicly available copies of all of that data at the University of Pennsylvania Library. So here's a map of the data rescue events we held across the country. And then we also have begun monitoring federal websites. We tracked 25,000 federal web domains for any changes to the word climate change or endocrine disruption, and work with a network of journalists, including people at the New York Times, Washington Post, The Intercept, and ProPublica, to share those reports so people can understand how climate change and climate denial is influencing how environmental data is available to children, for instance, through federal websites. And then we're also publishing rapid public reports that are an academic analysis of this administration. So we have an interview project with EPA current and former employees. Our first report shared their experiences of the transition. Our most recent report looked at how the actions of the Trump administration have increased environmental injustice already in the country. And we have a forthcoming report on changes to the way climate change is represented on federal websites. So I hope these examples just begin to suggest the power of really combining big data and networked monitoring that we have done within climate change with the perspective of communities and citizen science and environmental justice that's driven a lot of endocrine disruption research. And there's just so much potential there for us to, at this moment, begin building collective open source and public data infrastructures and tools, even without funding, as Megan so rightly points, that we really need to act now to protect the public right to research and build research publics. Thank you very much.
Thanks a lot, Sarah. I think the work you're doing is incredibly important. I think even if we had an administration more interested in collecting data and measuring the impacts of unconventional production, they wouldn't have the funding that was necessary to capture emergencies or capture what's going on in the neighborhood. So I just think what you're doing needs to be done in every community, and I just want to congratulate you on your work. It's just incredibly important. I'm going to open up questions and answers now. And we have one question from Ted Shetler to you, Sarah. Can you say a few words about why so many different chemicals are used in fracking? Are they individually necessary because some specific physiochemical characteristic, or is this a mechanism for disposing of excessive amounts of various byproducts from chemicals?
You know, I wish I had a good answer to this, in the sense that I'm not a chemist, and I don't understand all of the nuances of why all these different chemicals are used. In some respects, it's because some aspects of the chemistry require another aspect. So for tightly linking fracking, tightly linking chemicals that are used in fracking, you use one set of chemicals, and then in order to break those links later, you use things like surfactants, because there are bacteria that grow very well downhole in wells. You need to use biocides to kill those bacteria so that the cracks can remain open. But it really is an open question, and this industry just has not had to answer the questions clearly of why they use these chemicals, when, in what amounts, and there just hasn't been systematic study of this practice before we started doing it in 33 different states in a massive way.
Okay, thank you. It's a complicated question, I think, and so thanks for your answer. So Megan, you talked about your work with the different states that are funded by CDC to do biomonitoring and getting that data into the decision-making process. Do you have any examples of how that's been happening, and possibly in a particular state, or the kinds of things that you're doing to encourage that to happen?
Sorry, Cheryl. So I was getting a message to unmute my microphone while you were talking, and so I heard the first part of your question about what states are doing. Was it regarding biomonitoring?
Yeah, just interested about your efforts to encourage states that are funded by CDC to do biomonitoring.
Yeah.
And I think they're doing it in different ways, and trying to get that data collection, the information from that biomonitoring, to inform the decision-making process in various ways. Do you have any examples of how that whole process might have been institutionalized, or what example of how that has worked?
Well, your great state of California, you're in California, is that right?
Yes, I am.
Yeah, the great state of California actually legislated biomonitoring into their state law, similar to Minnesota. Minnesota was in response to finding a lot of perfluorinated chemicals in wells due to some of the industries in Minnesota. And so the state legislature, maybe a decade ago, actually decided, because of the uproar from the public, writing to their legislators, that they were going to monitor this, and they were going to look at biomonitoring. And they were able to show over time that as these sites were remediated, and as they tried to get the perfluorinated chemicals out of the water, that people's levels in their body were going down. So those are two examples of states that stepped up outside of funding from CDC. And there have been others that have talked about it as well. The National Conference of State Legislatures, every once in a while, will do something for their members on biomonitoring. What I hear from a lot of legislators, though, sadly, is I don't want to go looking for a problem that I don't know if I can fix, or that's going to cost a lot of money to fix. And so when I would talk to legislators, I would emphasize that a lot of times we don't find problems. And so it can actually, biomonitoring can be used to help calm people's fears. So a lot of times if you do biomonitoring, you find, no, your levels of this chemical are about the same as the general background in the United States. And so sometimes we're able to not necessarily dig up problems. Does that answer your question a little bit?
Yeah, that's very helpful. Thank you. So we've got some questions coming up from our call-in participants. So let me just read a couple. One is, Megan, did you ever get a chance to test the ash, and how can communities get answers to questions like this now? So if somebody had a problem with ash next door, or pesticide exposure, whatever, what kinds of changes have been made so they can actually call an agency and get some answers, get some testing done?
Yeah, so unfortunately, I did not get that woman's information because at the time I didn't know how I could help her.
Mhm.
And I've desperately tried to figure out how to find her, but I haven't been able to. But I hope that by going forward and working on this, now I can help other communities. And so yes, communities can try to get answers to their questions like this now. And the best way is to contact your health department. Unfortunately, sometimes health departments have a complex bureaucracy about how such a request has to get to the public health lab. And so that's why one of the ideas that came up in that Meeting Community Needs project was the idea of having an ombudsman for every health department, to have somebody to help you navigate the system and to stay with you from day one all the way through to the end until you get your answer. And another suggestion that came up was having, like, Baltimore City has a 311 system. So for police non-emergency questions, you can call or you can online put up a question, and then 311 tracks it through the system to make sure that somebody responds to your question within a reasonable amount of time. So
Wow.
those were two sort of more short-term solutions to how we can better answer community needs and make sure that they're getting the answers they deserve. But I honestly think the system itself is sort of broken. We have to break down the bureaucracy and the complexity, and we have to think about customer service more than we're used to.
Oh, okay, yeah. I think it's you're doing a great battle in trying to get that, not necessarily a battle, but a kind of a collaborative effort to break through the bureaucracy to get those questions answered. So thank you for that. I have a really great question from Michelle Roberts, who asks, how can organized collectives work together with you all to better amplify their voices and solutions? And she's thinking particularly about the Environmental Justice Health Alliance for Chemical Policy Reform, who she serves. And one community she considers is losing their rights to their community from a not so voluntary buyout to build the biggest ever ethylene oxide cracker. How can we include biomonitoring on work in citizen science? So Sarah, can you take that on? I know Michelle Roberts is a great activist and really could use some of your help and monitoring and stopping some of these ethylene cracker plants that are being constructed in the Southeast.
Yeah, sure. I mean, it would be great to connect Michelle with Public Lab and see if any of the Public Lab tools might be useful. With a group that I worked with in Chicago, the Ban Petcoke campaign, just really taking satellite-like images using balloons of the location where this petcoke was stored was really powerful for them in their advocacy. And I could imagine doing some really great community mapping projects that would really express what the impacts of building this space would be on this community, and especially connecting with communities along the Louisiana Chemical Corridor and Louisiana Bucket Brigade about those experiences. And I think these are the networks we really need to build right now. How do we better network grassroots communities and then network academics too, who've worked really actively, like Wilma Subra in the public interest. So that would be my suggestion, is that we should chat about connecting with through Public Lab, but biomonitoring does also seem key. Megan, maybe you have some more insight there.
Okay, so I think that's a really good answer, and we'll make sure that you, Sarah, and Michelle Roberts get connected. And Megan, did you want to respond to the biomonitoring question? I'm sorry, I jumped in a little too quickly there.
That's okay, no worries. So I do think that biomonitoring is very important. I think especially getting a baseline before fracking begins or before something happens. During the Gulf Coast oil spill, I remember calling for biomonitoring and being rebuffed because people said, well, we don't have a baseline with which to compare it. So we wouldn't be able to tell if these were elevated exposures or if this was the background. And so I think we need to start doing biomonitoring sooner rather than later, but we can't use excuses. And so if you want to include biomonitoring in your work, I would recommend reaching out to your state health department. But if they've not been helpful, I read ahead in the questions, and I know Michelle a little bit. So if your state health department isn't helpful, I recommend reaching out to APHL, the Association of Public Health Laboratories. on that site, the meeting community needs site, there used to be a way for the public, and there might still be a way for the public to reach out and ask for help from APHL. Nobody really used it that much, so it might have gone away, but it might also still be there. And I can work with you, Michelle, to also make some connections.
Wonderful. I just want to say that we just got it from an anonymous attendee saying these women are amazing. So just so you know that. We're almost at the close of the time for this webinar, but I would just ask really quickly whether you have each a question for the others. So Sarah, is there something you'd like to ask Megan, or Megan something you want to ask Sarah? You don't have to, but if there's something that came up.
I would love to say that it's such an honor to present with Sarah, because in my mind, she is the person that's out there and doing this and creating tools for communities. And I admire what she's doing so much, and I hope that I can follow in her footsteps.
Oh, well, likewise, Megan. And I think it would be really great if we could start thinking about how to collaborate with academics and the American Public Health Laboratory System. Public Lab has had a few collaborations, but really, how do we strengthen these networks for this just vast capacity that we have to do this work that is going unused? So, I mean, I just look forward to a future of working together.
Perfect. Okay, you guys. Well, you guys are actually wonderful, doing wonderful work, and these are excellent presentations. But we've come to the time that we need to close this webinar, and I would encourage the calling in participants to look at the Collaborative on Health and Environment website to learn about upcoming webinars that will continue to feature these exciting young scientists under 40. They're doing such amazing work and moving forward the issue of environmental health. Maria, do you want to officially close the call now?
Yes, thank you so much, Cheryl. We are approaching the end of today's webinar. A video recording will be available on the CHE website soon, and tomorrow you will receive an email containing a link to the recording. CHE's next webinar from the CHE EDC Strategies Partnership will take place next Tuesday, December 12th, and is titled Examining Environmental Contributors to Autism. To learn more and to RSVP, please visit our website at healthandenvironment.org. If you are new to CHE and would like to stay updated about upcoming events and more, please sign up to receive our newsletter by selecting the Join tab at the top of any page on our website. Additionally, if you appreciate these CHE partnership webinars, bringing you the latest environmental health research for free, we encourage you to support CHE's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speakers once more for taking the time to present today, and Cheryl for her excellent moderation. Thank you so much for joining us, and have a great day.